2 minutes.
Hi everyone, this is Dr. Padmavathi, Vema from Cuddles, Secunderabad. I'm senior gynecologist and doing lab surgeries in this center. Now I wanted to share few facts regarding the total lap hysterectomy, which is sutureless, which I have been doing this since last 20-25 years. First, I want to enlighten you regarding when this hysterectomy is needed. Usually, we prefer surgery once the medical treatment is failed in a woman who is suffering with abnormal uterine bleeding. The reasons may be varied, like fibroid, adenomyosis, endometrial hyperplasias, and all. We first try the medical management, and they are not getting better treatment with that. Then we advise surgery, that is hysterectomy. Hysterectomy used to be open procedure previously, that is almost 15-20 years back. In India, we have adapted lap hysterectomy since last 25 to 30 years, but people are not so aware of this. That's why I wanted to tell you, in this center of Secunderabad KIMS Cuddles, we are doing lap hysterectomies even for bigger size fibroids, which is very useful, patient friendly, because in open hysterectomy, we do open the abdomen with large incisions of around 10 to 15 centimeters, where multiple layers will be opened and sutures will be done, and hospital stay will be more, and we need to remove the sutures after 1 week or 2 weeks depending upon the patient's condition. But in minimally invasive surgery, where we have adapted this since last 25 years, and I have been doing this since last 25 years, because we have all equipment which is needed to do such high risk surgeries in KIMS Cuddle Secunderabad, where we have all 3D cameras with large screens. Not only that, we have equipment for vessel sealer and harmonic, morcellator, and endoknife, where we can operate on larger fibroids also. Here we have operated maximum size, me especially around 3.5 kg fibroid also I have removed with minimal incisions that will range from 0.5 centimeters incision, around 4 in number. Please start the slides. And this minimally invasive technique is very useful. The time taken for this surgery will be very less, around 40 minutes to 1 hour. If it is a bigger fibroid, then we may need to do it for 1.5 hour. Where if it is a larger fibroid, we cut the specimen with endoknife or morcellator, make into small pieces and take it out through the vagina. And especially this procedure is more useful for the patients. See the incisions, what we do here in the slide. Then in being a corporate hospital, here we get all high risk patients, where the patients undergo multiple surgeries, where we have multiple adhesions which are attached to the uterus, because nowadays section rate has been increased. With previous cesarean sections, bladder and intestines will be adherent to the uterus. In such conditions, the minimally invasive surgery is more helpful, because we get a panoramic view of whole abdomen, where we can take out all the adhesions very easily with the harmonic, and fibroids will have large vessels where we can control with the vessel sealers with minimal, hardly 50 to 100 ml blood loss will be there. And because it is a cautery, blood loss will be less, and we won't be using any suture material like in open surgeries. That will help the patient to reduce the infection rate, hospital stay, as well as less pain. the pain will be minimal. Patients on the second day itself, they get up and they'll get up, they move, and on the next week onwards, when second day, we'll be discharging the patient. Only slides. We'll be discharging the patient, and they can do household work. If they are working, they can go to work from the second week onwards. Especially, I wanted to enlighten you. Yeah, these are the large structures which we have been removed here. Still more are there. Because of the time, I can show only few to you. These are the additions in the first slide, and this is the large fibroid with multiple seedling fibroids also, where we cut and remove it through the vagina. This is the number of the fibroids recently we have removed from abdomen, which she has been suffering with pain abdomen and as well as abnormal uterine bleeding. You may not be understanding. This is the largest fibroid. I think this is around 2.8 kg recently we have removed. This is one more. Okay. So large fibroids with adhesions, with multiple surgeries, we are doing it successfully here in this center. And it is very patient friendly surgery. You can approach any of us here who are there 24/7, and you can avail the services at KIMS Cuddles, Secunderabad. Okay.